So what we're seeing is a lot of these offices are taking reimbursements of $80 for a cleaning. Their cost to run hygiene is $65. And after you factor in cancellations and the cost of additional staff to run those claims through, hygiene can be a break even at best. So implementing a membership platform allows you, first of all, it allows you to dictate what your reimbursement is because you dictate what your charges are. And second, if a patient misses a cleaning per year, they've already prepaid for that and the office accepts that as net income. So it becomes a lot less cyclical on how the office receives their hygiene revenue.
So it keeps it a little bit better flow.
Yep.
I would think more people, if they have prepaid, they're more apt to show up too versus, right? I mean, if you prepay for something, you're going to be there because you've already put the cash out.
Yeah, so that works both ways. Dental insurance patients don't necessarily view it as being prepaid, but when they're actively cutting that check for that membership, they're more likely to use it. And then cash patients are never prepaid if they're not on a membership. So if they don't see you in that 6-month period, then they are not realizing those, or they're not realizing those charges. And if the dental insurance patient doesn't see you during their once every 6 months, the insurance company keeps the money. So it's more likely to get both insured patients and uninsured patients in the chair.